Hi, I'm Dr. M Manoj. I'm a specialized sports physiotherapist. I'm also a director and senior consultant in Physio Gurgaon. Sports medicine in India is a growing field, and the speed of growth is very fast as compared to other orthopedic, neurological, and cardiac physical therapy. The growth is so big because people in India have started realizing the importance of health. Now they think that physical well-being is a must, and you see people involved in activities like sports. So the growth of development is faster. The more is the change which is happening in the field of sports. Like suppose India, they're winning medals in Commonwealth Games levels. They have won few medals in level of Olympics also. So the more is the involvement of country people in this level of sports, more is a need for sports medicine. Challenges, yeah. So as far as what is the role of physiotherapy in sports injuries, they've got three important roles. One is treatment of injuries. Someone athlete having an injury, definitely he can't be waiting for 6 months or 3 months like a normal individual to get rid of this thing, because his career might be over in that 1 year actually. So treatment of that injury at a minimum possible time is one of the important thing. Secondly, yeah, treatment if it happens with accidents, that's okay, but prevention of injuries is also prime motive of physical therapist. So why prevention? Yeah, there's a lot of money wasted, there's a lot of time wasted, there's a lot of skill wasted in treating an injury. So why not prevent injury? There is a separate branch called rehabilitation, which means it's prevention of injury, which is an gold standard, or it's a important aspect in sports. For that, there are specific programs. If an athlete undergoes this specific programs, and what is his training level and what is his training time, this all will be analyzed by a sports physiotherapist, and he'll be giving the best of solution for those wherever he feels that issues are there. They'll be giving certain specific instructions for prevention of sports injuries. The third part is improving the performance. Any sports, it is a repetition of particular activity. For example, if you take cricket, if it is a bowler, it is a repetition of that particular activity in an athlete. So when one thing is too much of use is happening in one area, definitely that area can have little imbalance. That correcting of that imbalance is an important aspect of a physical therapist, and by correcting that imbalance improves the performance of the individual. So these are the three things, like rehabilitation, prevention of injuries, and if he gets injured, how to take care of that injury. Third, improve the performance. For him, that 1 second of race or going 1 kilometer speed faster than his counterpart is the one which is going to give him the medal. So improvement of performance, there also the physical therapist plays an important role. So I also have played a role in Indian women hockey team, and the challenges which we are facing when I was with the team, players were even afraid to tell about their injuries. Actually, that was the main challenge which we saw. Like if they're injured and they think that if I tell about my injury, I might be seen as an injured person and I might not get an opportunity. So in sports, especially in team sports, educating the players about prevention, and if they get injured, how to treat it, and to definitely tell about the injury was an important challenge which we faced initially. Apart from that, now over a period of time, the players have understood that if I have an injury, it is important. It's okay, anyone can have an injury, but it's important that I tell the injury to the physical therapist. That's why a team physical therapist is an important part now. So telling about the injury itself as a one important step, And secondly, earlier we had means all our sports people used to go abroad for treatment of particular injuries. One main reason was non-availability of technology here. The manpower was good. Manpower is still good in India as far as the physical therapy of sports is concerned, but physical therapy didn't have the right technology to amalgam upon and get the individual fit in that particular time. Like I said earlier, a injured person, a normal injured person can have take his own time to heal, but as far as the sports is concerned, that 1 day period is very critical for him. So now talking about the technology, yeah. What is that we have brought in at Physioactive to treat that athlete in a particular time? Like I said earlier, we have good manpower which we already had, but the technology like Ultra-G treadmill, for example, if an athlete who is having an injury in ACL, one of the important ligament in the knee, he is not supposed to run for 3 months. So how do we expect him to go into the field in 4 months, 5 months? So this technology called Ultra-G like the name suggests, it takes the pressure off the knee and this athlete can start walking or running even in the first month actually, or as soon as the graft heals. Now the overall rehab is faster. Imagine this guy going into the field after 1 year. Imagine the same guy going to field in 4 months with the use of technology like Ultra-G. That's excellent actually. And for him, that 6 months is a very, very important period. And the chance of him going back into the sports, that also increases. Earlier, after an ACL, after injury of an Indian athlete, the chance that he goes to the sports was hardly 5-10%. Now with the technology is 55% that he can go back into the sports. We have other technologies like class 4 laser, which is a very good non-invasive method of treating deep injuries. Earlier they would do a small surgery to treat deeper injuries, but again whenever it is surgery, surgery is a surgery, you are invasive. So non-invasive laser is a good technology. Someone having a meniscal injury, you could give laser and heal them faster and heal them without invading their tissues. That's one more technology we have. We have technology called shockwave therapy. Athlete is the one who is training 6 to 8 hours in a day. He's stressing his joints, ligaments, muscles, everything. Someone is training for 6 hours in a day. Imagine the amount of stress his joints and the bones take. So as a reaction to that stress, they can develop something called calcifications or bone protrusions. Yeah. Normally they would inject on that area, or normally they would just chip off that bone, and again that needed an invasive surgery. With the technology like shockwave therapy, again this is a non-invasive method of healing calcified bones or those stress bones. You treat them with shockwave. It is as good as treating it with a surgery. Yeah, with the additional effects of less cost, you save time and go back to sports much faster. Here, after we started Physio Active, we had even national level athletes who have come here for help. For example, Namanoja was an Indian cricketer. He was playing his game in Delhi for the World Cup selection. So he had a back pain, and it was on Friday, I remember exactly. Monday he had a match, and someone has suggested Physioactive because we have that technology. So he came in here. We treated him like with a extended duration of time, and he was fit in 3 days, and he was able to go back and give his performance on Monday.